Osteoporosis is estimated to affect approximately 200 million people worldwide. With weak and brittle bones, patients can sometimes suffer fractures even as a result of small stresses. A lot of work has already gone into identifying risk factors for osteoporosis. I'm Alistair Freeland, and with me today to discuss bone health and nutrition, and more specifically plant-based diets, is Dr. Alexey Galchenko from the Federal Research Center of Nutrition, Biotechnology and Food Safety in Moscow. Dr. Galchenko, thanks so much for taking the time.
Thank you for the invitation.
Several genetic and lifestyle factors are believed to influence bone mineral density and fracture risk, particularly diet and physical activity. People on plant-based diets have for some time believed to be at higher risk of having low bone mineral density due to the lack of certain nutrients in their diet. So calcium, vitamin D, vitamin B12, and so on. Do you believe the benefits of a plant-based diet outweigh any risks on bone health?
Statistics show that only the risks. So the benefits and the risks, it means that statistically vegans consume, for example, more potassium or magnesium, and they have increased risks of zinc or vitamin B12 deficiency. But when we are working with exact vegan, he can also have potassium deficiency or folate deficiency, which are absolutely not typical for this type of diet. So our aim is not to change one risk to another. Our aim is to keep in mind the risks of every group. So when we are working with vegan, we remember that he should have low risk of potassium deficiency, and that's why we think more about zinc or vitamin B12. At the same time, working with omnivores, we remember that magnesium deficiency is absolutely widespread in Western societies. So just we remember about the risks of any groups and trying to avoid it.
What supplementation strategies do you recommend when you have older people that are on plant-based diets?
Older people on plant-based diets have double risks on the bone health. So firstly, just their age and vegan diet. However, they should pay special attention on their bone health. I think I would not recommend blind supplementation, even for those people, because I would recommend checkup firstly. I would recommend the assessment of nutritional status. I would recommend the assessment of the diet, the chemical composition of the diet firstly. I would recommend the assessment of different biosubstrates, blood serum, urine, or hair samples on the concentrations or of macro and trace elements or vitamins. Or I would recommend some special markers of the nutrient metabolism. For example, ferritin indicates the iron status much more precisely than the evaluation of iron concentration in any biosubstrate. So I would start from the investigation and then planning the supplementation strategy. At the same time, there are some nutrients, for example, omega-3 long-chain polyunsaturated fatty acids, and we have no golden standards for the estimation of their balance in the organism. So maybe in this case, I would recommend low doses of eicosapentaenoic and docosahexaenoic acids, for example, 500 to 800 milligram per day. Checkup of nutritional status is not enough, because talking about bone health, of course, it's logical to check the bone tissue. So I think at least they have they should undergo the ultrasound densitometry at least once per 2-3 years. But talking about older vegans, especially women, I believe that it's a good idea to make an X-ray osteodensitometry at least in 50 years age or 55 years age, because only X-ray can show us the bone mineral density in femur neck and lumbar spine, the places which are most often broken by the osteoporotic fractures. So if the bone density in these sites is okay, then they can repeat it in 5-10 years. But if it's have some problems, they should deal with dietitian and maybe endocrinologist. So osteoporosis is absolutely a widespread problem in older people, especially in women. So I think, I believe that we absolutely underestimate the importance of osteodensitometry as compulsory components of the checkup for those groups. It doesn't depend on the diet for all women older than 50 years.
Thank you, Dr. Galchenko, for your answers to these questions. Best of luck with your further research.
Thank you for your invitation. I was glad to participate in your project.
Thank you.
Best of luck and
Yes.
Happy New Year.